Hello, my name is Katie. I'm one of the physiotherapists working in the Women's Health Specialist team. I wanted to give you some information and some tips on how you can really help your body as it heals and as it recovers and strengthens again after your pregnancy. And I want to start off with just some really simple breathing. And during your pregnancy, you can find, particularly as your baby gets bigger, that actually you end up breathing at the top here quite a lot. So it's really good just to kind of teach your body that really nice tummy breathing again. So join in with me now. If you can rest your hands onto your tummy and then just notice your gentle breaths. Just notice that tummy rising and falling. And just whatever speed is a comfortable speed, just let your breaths, just notice that tummy rise and fall. Lovely, nice and soft. And as you're breathing, as your tummy's rising and falling, your ribs are also going to be expanding. So if you place your hands on your ribs now at the side and just notice those ribs widening as you breathe in and then closing again as you breathe out. So it's almost like an umbrella, just opening sides, opening front and back, and then closing again as you breathe. So just take some deeper breaths with me now. So breathing in, allowing those ribs to expand all the way open, and then breathing out, closing them down, really closing that umbrella all the way down. And those ribs can come back to that softer, closed position. And again, 2 more breaths. Breath in. And then long breath out. 1 more long breath in. And then long breath out. Well done. And actually stopping to do these breaths just at busy times through the day is really helpful, partly just to teach your ribs they can close all the way down again, to get their tummy gently joining in. But 2, actually it helps relax all the muscles through your body. It helps calm your mind. And it's really helpful for just to reducing those stress hormones that we find can kind of rise up just with the natural pressures of looking after a new baby in the house. So maybe try these a few times through the day. Your midwife will have spoken to you already about some pain control. If you've been prescribed painkillers, you know, you can take those regularly as the prescription says, just to keep you comfortable. If you've had a vaginal delivery and you're particularly sore between your legs, some people find it helpful to use an ice pack. So you might choose a bag of frozen peas, you might have a bag of crushed ice, wrap that in a tea towel, and then you can place that over the top of your underwear between your legs, and you can just kind of rest with that there for about 10 minutes or so, just to give you some pain relief. And you'd need to leave a couple of hours between times if you find that helpful and want to use that a few times through the day. We want to make it as easy as possible for you emptying your bowels. So to keep your stools nice and soft, it's really helpful to drink plenty of fluids, have lots of fruit and vegetables, fibre in your diet, just to keep your stools soft and get your gut moving. But what can be really helpful is actually when you're emptying your bowels is just using a little step under your feet. If you place your feet on that step when you're emptying your bowels, this just relaxes the muscles more effectively around your back passage, which just makes it easier for it to do its job for you. You might find that your tummy muscles are still going to be recovering. So actually we want to make it as easy as possible for you when you're moving around. So particularly getting in and out of bed, we'd recommend that you kind of sit on the side of your bed first and then tuck your feet up together onto the side and then drop yourself down onto your elbows. So you're lying on your side on bed before you then turn over to get to the position you want to be in. Equally, getting out of bed, roll onto your side first, and then you can drop your feet down together as you push up your shoulders to that sitting position, ready to stand and to move. And this just makes it easier on your tummy muscles as you're moving. Really regularly moving and regularly changing position is going to be helpful and more comfortable for you. So you just might have to change your positions kind of on a regular basis. So no matter what sort of delivery you had, your pelvic floor muscles will be weaker than before your pregnancy due to the hormone changes and just the fact you've had your weight of your baby that you've carried for these months. So it'd be really helpful for you to start some pelvic floor exercises just to really strengthen them again. These pelvic floor muscles, this is a model of the pelvis, and you can see that the pelvic floor muscles wrap from the pubic bone at the front right underneath to the tailbone at the back, and they come out to these sit bones at the side, so it's quite a wide area. And actually if you've had any injury in these muscles, actually doing some really gentle pelvic floor exercises really helps the blood flow. It helps with the healing, and as you build up strength over time, that turns into a strength exercise. So we recommend that everybody, every lady that does these. So these muscles go right round the back passage too, so that's a really good way of getting the muscles working. So you need to imagine as though you've got some wind, and you need to just tighten from the back passage as if you're stopping that wind, and you're lifting those muscles up and forward inside. And probably it's already lifted at the front, but you can imagine zipping round to the front and lifting up through the vagina as well, holding that for a few seconds and then releasing those down again. And if you can do that a few times in a row, that would be great. And what we'd like you to do is gradually build up. So eventually you'll be able to do a 10-second hold, and you'll be able to then release. Make sure you let go fully in between, soften those areas between your sit bones, release around the back passage. And then we want you to repeat it 10 times. So you'll be able to do 10-second holds, repeated 10 times. And then you're going to add in some quick ones. So same muscles, squeezing up, release. And you're going to do sort of 10 of these quick squeezes. Okay, so it's actually really recommended that you do these a few times a day, and it's the hardest thing is sometimes remembering. So some ladies will choose to do it every time they feed their baby as a way of remembering it. There is an app called Squeezy, which is an NHS app that is available for a few pounds online. That is just one option of having a reminder and keeping a log in just helping you continue these. We'd really like you to do these over at least 6 months or so to really build up and get that endurance of your muscles. Thinking about your tummy muscles, your deepest layer of abdominal muscles, it wraps all the way round your tummy, round to the back, almost like a natural corset or support belt. But these muscles have had to be longer top to bottom, they've had to sit a little bit wider during your pregnancy. So it's great just to get these working a little bit more now, kind of connecting together again in your new non-pregnant states. So a good way to do these is just getting it working with the pelvic floor. So if you rest your hands on your tummy really gently, and I would like you just to tighten the back passage as if you're stopping wind, and just really lightly draw your low tummy in, almost as if you're tightening a really low belt, lower than your belly button, and then release again. And then we want to repeat this, and if you can, time it with your breath. That would be wonderful. So you take a normal breath in, and as you breathe out, tighten the back passage, lightly draw your low tummy in lightly, and then release again as you breathe in again. So once more, breath in to prepare, breathe out, tighten your back passage, up and forward, drawing your low tummy as you breathe out, and then release again with your next breath. Well done. And just practice getting these timing together is really helpful for those tummy muscles, those abdominal muscles and the pelvic floor muscles to become a lot more automatic, just working for you, just naturally recruiting with your breathing. We'd like you, as you move around, as you hold your baby, as you lift your baby, not to hold your breath as you go to lift your baby. So if you can get in the habit of, as you go to lift, you take a normal breath in and then you lift as you breathe out. It just balances those pressures really well around the pelvis and naturally recruits those support muscles that we've just been talking about. For those of you that have had a cesarean section, you might find that your scar is a little sensitive in the early weeks. And so if you need to cough or sneeze or sometimes even laughing, that can just be a little bit uncomfortable. So you can support your wound, your scar, using your hands if you need to cough, and maybe even just engaging your low tummy as we just did in that exercise, drawing your low tummy in, a little bit of pressure with your hands just over that sensitive area can just really make things more comfortable for you. Over time, as your body's starting to recover, you're going to want to get going and get moving a little bit more. And as your energy builds up, we'd really encourage you to start doing short walks, obviously initially at home and then out when it's safe to do so. And you can build up your activity levels gradually, and you just need to listen to your body, see how it's responding, take regular rests and regular breaks. But the expectation is that over time, really slowly and steadily, you'll be able to do a little bit more and a little bit more. There are a couple of symptoms you could look out for if you might have overdone it, and this would be just a sudden increase in tiredness, or heaviness or aching between your legs, or if there's a vaginal discharge that restarts after it's stopped. So if these things occur, then do cut back again on the level of walking or activity that you're doing, and do chat to your GP if you've got concerns. Over the coming months, if you still have symptoms with your bladder or your bowels kind of after your baby's kind of 6 weeks or so, or even if you're struggling in those earlier days, we're here to help you. If you've got any concerns about your physical recovery, you just need to chat to your GP or chat to your health visitor, and they can send a referral to our specialist physiotherapy team, and we can arrange to chat to you. If you have had a tear or an injury during your delivery, so if you've had a 3rd degree tear or a 4th degree tear, we will automatically be getting in touch with you to have a chat at 6 weeks, just to kind of catch up with how you're doing and what's really going to help you over the coming months in your recovery. Thanks for listening.